Another question that came out of those results was, what if instead of a methoxy, it's an ethoxy or a propoxy or an isopropoxy,
right,
so on and so forth. And now you can see how that blows up in all sorts of directions until ultimately, and I can't give you the punchline yet because my collaborator Grant Glatfelter would murder me because the paper's not out yet. But those are the areas that you can look at, and then when you look at a lot of examples from each of those areas, then you can come up with kind of a rule that all the molecules fit, and you can kind of understand it.
Mm-hmm. Are you guys pursuing at all? So a lot of people are pursuing, as I mentioned earlier, this quest to create psychedelic derivatives that have therapeutic potential but don't have hallucinogenic effects. Are you guys doing that at all? And have you, found any good candidates?
Let's see, at CamTech, that's a big topic. Let me think how to address that. So for one, we absolutely have serotonin 2A agonists, which is what all these psychedelic molecules, that's what everybody's excited about them for. We have drugs with that showpiece property that do not cause the head twitch response in mice, and the head twitch response is the gold standard for whether or not a person would have a psychedelic experience. And so that's been one area of study for us. Some of those molecules that we have that are 2A agonists that don't do the head twitch response, and speaking of things that lead to whole areas of investigation, we figured out that the reason for that is that they don't cross the blood-brain barrier. So a great example there is norsilocin. And of course and now you see how these overlap. We made a whole bunch of prodrugs of norsilocin.
Yep.
And if you administer norsilocin to a laboratory animal, or you can do studies on human tissues, it's a full serotonin 2A agonist, so even stronger than psilocin, but no head twitch response, and that's because it's not getting into the central nervous system. It's not getting into the brain where the head twitch response would be brought about, and so administering norsilocin to a person would not cause them to have a psychedelic experience.
Okay, so it's still binding the 2A receptor, the so-called psychedelic serotonin receptor, but the reason it's not having hallucinogenic effects is it doesn't actually get into the brain because it can't cross the blood-brain barrier.
That's our conclusion. Of course, you have to preface this with in science, you're always at the whim of kind of like one experimental result. Like everything can fall out from under you when somebody has one result.
Yeah.
But for norsilocin, we're pretty sure that the explanation to the serotonin 2A agonism and lack of HTR is that it's not getting into the central nervous system.
Yeah, and so this proxy behavior we have for hallucinogenic activity, the head twitch response in animals, everything that we know is psychedelic or hallucinogenic in humans, if you give it to a mouse, in just about every case, they'll have this head twitch response. And so there's a really nice correlation there, and we have this behavioral readout we can use in animals to assess whether something is likely going to be hallucinogenic in humans when we say create a new drug. Has anyone taken a drug that does not create the head twitch response in a mouse and does have 2A receptor activity or whatever, and then given it to humans and confirmed that it's a bona fide non-psychedelic or non-hallucinogenic compound, or are we still waiting on that?
I think that there are a handful of examples where there are drugs that people have taken that are serotonin 2A agonists and not HTR active. There are a handful of examples confirming that correlation. So that nothing's perfect, right? But the head twitch response seems to be a very, very good indicator of whether a drug would be psychedelic in a person. Of course, then the area of study that becomes super interesting is where are the exceptions? And I think there are a couple of sort of fringe cases there. I think bromo LSD and glyceride might be 2A agonists with no HTR, that if a person takes them, they might feel something, but what are they really feeling?
Yeah. Okay, so these are LSD-like compounds.
Right. And then there are some molecules out of the ibogaine plant, I think, that are still also not very well explained. I think TBG might be one of them. I'm doing this from memory, so forgive me here. But David Olson and his lab have studied a bunch of molecules that have some 2A activity and no HTR, so 2A without the psychedelic effect. Our labs have reproduced some of that data, and we're still sort of struggling to find an explanation that explains everything. Those molecules, nothing's ever just 2A or not 2A.
Right.
So there's other pharmacology in there that could explain a lack of head twitch response. For example, serotonin 1A activity can often mask it. And I think if I remember correctly, in the case of David Olson's compounds, the dose, in some of the data points was awfully high. And there won't be HTR at high doses for most psychedelics because you've basically zonked.
Right.
Yeah.
At some point, you're tripping so hard, the little mouse trip. Yeah.
Serotonin syndrome.
Yeah. Serotonin syndrome. Explain what that is for people and what some of the risks there can be from high dose psychedelics.
I'm not an expert on serotonin syndrome per se, but overstimulation of that system and overstimulation of that receptor can lead to, in animals, basically a lack of activity, right? So let's use that example. As I continue to give higher and higher doses of a classic psychedelic, the animal is going to do the head twitch response more. Shake its head more.
It's tripping harder, quote unquote.
It is, yeah. But then just like an upside down U, the letter U, you'll get to a point where it starts to go down again to where you don't have any HTR anymore, no more head twitch response, and that's because you're flooding that system or hitting that button so hard that the animal is comatose or shut down in this serotonin syndrome-like state.
Yeah. This would be another reason why playing around with MAOIs in conjunction with these and other drugs can be so dangerous.
Yes, with any of this stuff, you ought to know what you're doing.
Right.